Staff shortages became a major issue for many businesses during the pandemic, and now the situation is even worse, especially in the world of healthcare, where overwhelmed hospitals and nursing homes are seeing employees leave rather than get vaccinated. For more on this, we're joined live on the KCBS Ring Central Newsline by Paul Seegert, managing partner at PCS Advisers. That's a California-based healthcare benefits firm. And Paul, thanks for getting up early and joining us this morning.
Thanks for having me.
So this is a dire and kind of paradoxical worker shortage. How bad is it going to get?
Well, it's gotten bad enough in some areas. These things always hit rural areas harder and quicker, and we do have some examples around the country of rural healthcare facilities that may be the only hospital in their county that are discontinuing certain services. In some cases, they've said we won't be able to do labor and delivery, or we won't be able to do elective surgeries because we don't have the staff.
So this is really going to impact healthcare. Do you expect this rationing to go to other parts of the country? And what about urban areas?
Urban areas will be affected as well, more so in that they are having to increase wages and add benefits to attract the talent that they need. So it's affecting them a little bit differently. But there was a shortage in the industry that predated COVID that this has just made even worse. You have nurses that are getting to a stage of burnout, and we've got in California, over 40,000, a shortage of over 40,000 full-time equivalent RNs.
I mentioned the paradox here, which is that you need these nurses in the healthcare industry because you have this surge in COVID cases. However, the businesses, the hospitals have decided if you don't get a vaccine, we're not going to employ you to do that. So you're creating a shortage as well as suffering through one.
Well, that's right. And we have seen some creativity around that. Kettering Health in Ohio, they allowed an additional exemption to their vaccine mandate, saying that if you had natural immunity and you would show antibody testing on a quarterly basis that proved it, then you could delay getting vaccinated until the point at which that immunity waned. And that was a creative way for them to deal with it. Perhaps others will adopt that kind of thing, because one of the biggest pushbacks from some of these nurses is that they have been exposed to COVID and they have natural immunity.
That does sound creative. Has there ever been a situation like this before? Is there any proof that mandates like this will boost worker vaccinations?
Well, the states that did it most early have, like a state of Maine as an example, they did. There was pushback, there were protests, there was acrimony and all of that, and even lawsuits. But in the end, most of the healthcare workers did end up getting vaccinated. And if you look at some of the other spots around the country where these mandates have gone in, you may have a hospital system that has many thousands of employees, and when it all is said and done, they may end up laying off or firing 100 or 200 people. It's not a massive number or percentage. United Airlines is another good example where they're laying off or firing 593, but they have a workforce of 67,000. So it ends up being a pretty small percentage.
Yeah, I was going to ask, did some of these employees think then that this was some sort of feint or bluff from the organizations and they wouldn't actually go through with it?
Yeah, I think they were waiting. Before the presidential mandate came out, I think they felt there was a feeling that many employers, especially in the healthcare industry, would not put in a mandate because that 3% of their workforce is so critical, or that 1% or 2% because of the pre-existing shortage that they had. And in our conversations with healthcare CEOs, many were hesitant to put in a mandate because of their staffing issues. And now, even if they wanted to, and now you have some that have the cover of the national mandate where they can say, look, we're being forced to do this. And that kind of gives them the cover to move forward and put that mandate in place.
Going forward, you were talking about a 40,000 shortage of nurses. What do they have to do to attract people to the industry?
Well, there's certainly burnout, and there's compensation that's an issue. If you look at what a traveling nurse earned 2 years ago, it was about $1,900 a week. It's up to $3,500 a week with signing bonuses. So they are responding with more competitive compensation. But when we see that group of people get polled, they're asking for other benefits as well. Mental health benefits is a big request. So I think there's a big we're at a big moment in time where benefits may get back to what they were when they started, where they, when fringe benefits became a thing, it was to attract the talent by giving them a more robust package. And I think we're at that point right now as a result of COVID.
All right. Paul Seegert, managing partner at PCS Advisers, thank you so much for joining us to discuss this.